Hello everyone. Today we are going to discuss about the topic intubation. Intubation is a life-saving procedure performed in emergency cases in which the patient is unable to breathe or their airway is blocked. Going forward, we need to understand what is an emergency. Medical emergency is an acute injury or illness that poses an immediate risk to a person's life or long-term health. The emergency can be verified using three parameters, namely consciousness, respiration, and cardiovascular system. Protocol for emergency. It is a plan of action developed to manage emergencies properly, in which we follow ABC protocol, where we measure airway, breathing, and circulation and act accordingly. Intubation is a process where healthcare provider inserts a tube to a person's mouth or nose, then down into the trachea. The tube keeps the trachea open for air passing. Insertion of tube through nose is called as nasal intubation, while insertion through mouth is called endotracheal intubation. Indication of intubations are airway problem, inadequate circulation, central nervous system problem, and muscle weakness. The following instruments are required for a smooth and complication-free intubation. Personal protective equipment like surgical mask and gloves, laryngoscope with its blades, endotracheal tube or ET tube, McGill forceps, stylet, syringe, oral suction, tape, and tube exchanger. Procedure. Proper positioning of head is important. Patient is taken on the table in supine position with their neck extended using towel roll such that their lower neck flexion and upper neck extension occurs, as shown in the picture below. This gives doctor a clear view of the passage during procedure. After positioning of head, following steps are performed. Open the patient's mouth with the right hand and remove any denture. Grasp the laryngoscope in the left hand. Spread the patient's lip and insert the blade between the teeth, being careful not to break a tooth. Pass the blade to the right of the tongue and advance the blade into the hypopharynx, pushing the tongue to the left. Lift the laryngoscope upwards and forward without changing the angle of the blade to expose the vocal cord. External manipulation of throat is done to get a clear view. Epiglottis protects the airway passage. Look for epiglottis. If initially not found, insert laryngoscope further. Once epiglottis visualized, push laryngoscope into vallecula and apply traction at 45-degree angle to push epiglottis up and out of the way. Do not push once view is optimized. Insert ET tube into far right aspect of mouth. Insert ET tube above and between arytenoids and through vocal cords. Try to visualize the ET tube passing between the vocal cords. Complication of intubation can occur two times. First, during intubation, or second, after intubation. At the time of intubation, following complications can occur. First, trauma to the lip, teeth, tongue, and nose. Airway perforation, laryngospasm, bronchospasm, tachycardia, bradycardia, arrhythmia, tension pneumothorax, spinal cord and vertebral column injury, hypertension, pulmonary aspiration. After intubation complications include displacement of tube, obstruction of tube, or equipment failure.